Hey everybody, Dr. Rafich here from Vet Triage. It's Tuesday, December 3rd, 2024, 11:03 a.m. Pacific time. I'm in a hotel lobby in California, Southern California. So excuse any background noise. We are starting a brand new journal today, JAVMA. This is the February 15, 2017 edition. We're going to start with the What's Your Diagnosis? And here are the images of that. There we go. So this is a 4-year-old, 39-kilogram, intact male German Shepherd, had 2-day history of vomiting, anorexia, lethargy, panting. On physical exam, the CRT, which is capillary refill time, was prolonged at over 2 seconds. The complete blood count showed a leukocytosis and a thrombocytopenia. The serum biochemical analysis, which is the chemistry panel, was normal, and coagulation time was also normal. So leukocytosis, when you think about elevated white blood cell count, there's only 3 causes for it: inflammation, infection, and cancer. And then as far as thrombocytopenia goes, you should think about it in terms of 4 different categories, the same categories you would think of for anemia. So things like excessive destruction, excessive loss, sequestration, and decreased production. Those are the 4 reasons why you have thrombocytopenia. And so they took these radiographs, and you can see on the radiographs here the changes to the abdomen. So what it's showing there on in side A is severe colonic distension with gas. The stomach is also distended with gas and fluid. And then they want to show there by the pelvis with little crosses that the descending rectum, colon rather, has been narrowed down acutely to regular size. And then on B is a similar thing, VD view, and it's showing that the colonic distension is present there, as well as displacement into the left quadrant of the abdomen. So a colonic torsion was suspected. Differential diagnoses for colonic dilatation and displacement include colonic torsion with or without volvulus, compression or displacement by an intra-abdominal mass, colonic or cecal-colic intussusception, obstructive infiltrative mass of the colonic wall or other causes of colonic stricture and functional ileus, and perineal hernia. They also found this radiograph decreased serosal detail. So you can have decreased serosal detail usually if there's fluid accumulation in the abdomen, or if the patient is in poor body condition, which this German Shepherd was, then you'll have poor serosal detail because of a lack of abdominal fat. So they did abdominal ultrasound, which found coarse, hyperechoic, homogeneous mesenteric tissue within a moderate amount of regional free abdominal fluid localized to the caudal portion of the abdomen, as well as mild lymphadenopathy of the juxta-intestinal lymph nodes. Lymphadenopathy has 3 causes as well. It's either be infection, reactive, or inflammation, and cancer. Treatment and outcome. They collected peritoneal effusion and found neutrophilia with no bacteria. They compared glucose and lactate concentrations of the fluid with serum, and it was consistent with septic peritonitis. So they performed an emergency exploratory laparotomy, also known as a celiotomy or abdominal exploratory, and they confirmed colonic torsion volvulus with septic peritonitis. They performed the ileocolic resection anastomosis due to loss of vascularity to the colon. The dog spent 4 days in the hospital on IV fluids, analgesics, antimicrobials, and was sent home with no signs of malabsorption secondary to colonic resection. So I would also argue that malabsorption after colonic resection or any kind of large intestinal resection can happen weeks or months later. So it's weird that they assumed right off the bat that there was no malabsorption just 4 days after surgery. I'm not sure that's accurate. 5 months later, the dog had a recurrent colonic torsion, so went back to surgery and did a colopexy. And then 7 weeks later, another torsion, and they euthanized. Okay, comments. Colonic torsion in volvulus is rare. Vascular compromise causes necrosis, perforation, sepsis, and death. It's seen in medium to large breed dogs, young to middle age, German Shepherds, Great Danes, Labrador Retrievers, Bull Mastiffs. Gastropexy, either prophylactic or performed at the time of gastric dilatation volvulus, appears to be a strong predisposing factor for colonic torsion. resulting from entrapment and strangulation around the gastropexy site. Dogs with colonic torsion have had concurrent GI disease, including exocrine pancreatic insufficiency, lymphoplasmacytic enteritis, bacterial overgrowth, intussusception, cancer, and enteric parasites. It's unfortunate they didn't mention a biopsy of the colon in this study. I don't know if they didn't submit it, but I would always recommend submitting anything you remove from the body, and that way we can figure out whether or not there's any histopathologic abnormalities. Radiographs suggest colonic torsion includes segmental dilatation, abnormal positioning of the large intestine into the cranial portion of the abdomen. In the dog in the present report, ascending and transverse intestines are displaced to the left cranial aspect of the abdomen, as opposed to the normal anatomic position in the right portion and middle portion, respectively, of the abdomen. Colonic torsion caused by strangulation of the intestine at a gastropexy site can result in displacement of the intestine to the right cranial side of the abdomen. The diameter of the colon in the dog should be less than the length of the body of L7. A colonic diameter surpassing that value should raise suspicion for disease or injury. Difficulty in differentiating between small and large intestine is not uncommon. Causes of adynamic small or large intestinal ileus must be considered and potentially ruled out prior to surgery, as radiographs may not distinguish between torsion and other non-surgical diseases. It is frequently the case that emergent exploratory is elected based on history, clinical signs, and radiographs without a confirmed diagnosis. And I agree, considering it's a German Shepherd with those kinds of radiographs, I would have taken him to surgery even before an ultrasound was done. Ultrasound will show gas within the intestine that is an intraluminal, highly hyperechoic reflective interface with distal acoustic shadowing, thus preventing evaluation of the contents of the lumen, as well as deeper structures. Conventional radiographs are highly recommended when colonic torsion is suspected because this is the ideal imaging modality to provide either definitive diagnosis or at least an indication for exploratory laparotomy. Colopexy to the left of the abdominal wall is typically performed to prevent recurrence of colonic torsion in the dog. The present report, colopexy was not performed during the first surgery because they were worried about the fragility of the surgical site. All tissue was viable when evaluated during the second exploratory laparotomy. The cause of recurrent colonic torsion following colopexy in this dog is unknown. So that's a rare but severe disease that you can see with dogs, and not limited just to German Shepherds. There are other breeds that we mentioned. So thanks again for those who watch in the playback, and we'll be back again tomorrow for another one. Take care.